Good morning, everyone. This is PA in the AM coming to you live on Friday morning, and today I'm going to be talking about nosebleeds. Nosebleeds is very common, especially in children, and oftentimes I get consults from parents that are very concerned because kids are getting sent home from school, going to the nurse's station because they're having daily nosebleeds. The main culprit of all these nosebleeds is due to something called the Kisselbox plexus, and that's in the center part of the nose. We have the septum that separates both of our nostrils, and there's this plexus of vessels that are right in the front center part of the septum. And so the majority of the time, in children especially, that is the location where the nosebleeds are occurring from. So when you're going in to see an ENT or the pediatrician, the main questions that I would ask or another provider would ask would be, how often are they happening? Are they happening daily, weekly, monthly? And which nostril are they occurring from most frequently, whether it's the left side or the right side? And have you ever gone to the emergency room for your nosebleeds? Have they ever received a blood transfusion for their nosebleeds? And are they having any nasal obstruction or allergy symptoms? And is it seasonally worse in the summertime or when it's hot out, or in the wintertime when you have the heater on and the air is really dry? So just be prepared for those to be asked to you if you do come see one of the specialists. And so for the actual treatment for nasal cautery and children, if they're over the, I'd say, 10 to 12 years old, you could actually do what's called a nasal cautery in the office. And what that procedure would entail would taking some numbing medicine and putting it in one of the nostrils that bleeds the most frequent. And then that sits there for 5 to 10 minutes. And after the numbing medicine is working, then we use a chemical called silver nitrate. It looks like a little matchstick. And I just paint the blood vessels in the front and center part of the nose, and that helps prevent future nosebleeds. After I use the silver nitrate, I use a bacitracin or antibiotic ointment and paint that area as well. And so even though that is one of the main treatments, it is only a temporary fix because those blood vessels can grow back. So the main way is to prevent nosebleeds. And one of my favorite things for Favorites Friday is a nasal saline gel. One of the brands is called Ayr, A-Y-R. And so the nasal saline gel, when you place it in the nose, you can use a Q-tip or your pinky finger, and you just paint the front center part of the nose on both sides of the nostrils. And after you do that consistently, sometimes you don't even need a nasal cautery, but again, those blood vessels can grow back, so sometimes you have to come in and get it done frequently, whether it's every 6 months, every couple of years, but that is needed for some children. So for adults with nosebleeds, sometimes it can occur from the back part of the nose or the posterior part of the nose. And if I get a call in the middle of the night about a nosebleed, then I often have to figure out where it's coming from. And so taking a nasal endoscopy or a little camera and putting it into both nostrils to see the location, that'd be a better way for me to determine the intervention. And oftentimes I would just use a nasal packing. And that nasal packing could stay in for a couple of days. And once the nasal packing is removed, then more likely or not, we can figure out the location of it. But oftentimes it's really hard when adults are on blood thinners like Coumadin to get the nose to stop bleeding, even with just a simple nasal cautery. So prevention is key. The best way to prevent nosebleeds is to discourage your kids from picking their nose, because a lot of times when they're picking, they're hitting those blood vessels, and that can cause a big ugly nosebleed. Again, the nasal dryness, the treatment is with the saline gel. I'll put the link to the nasal saline gel AYR below on Amazon to purchase. It's very inexpensive, and that you would use in the morning and at night before bed indefinitely until they grow out of this problem. So maybe for years they're using this problem. So I always recommend putting the nasal saline gel right next to their toothbrush so they remember every time they brush their teeth, they just paint the front center part of the nose with a little Q-tip. And another way to prevent nosebleeds is to use a humidifier. Again, I'll put a link to another one of my favorite things below. They make these really cute animal humidifiers that you can use, and it's a cool mist humidifier. And that can help moisten the air that they breathe in at night. Again, humidifiers can cause a lot of moisture, and we worry about mold, so just make sure you clean it regularly and pick out whatever animal they love, and that'll help them, encourage them to use it on a regular basis. So to stop a nosebleed, it's important to hold pressure in the front and center part of the nose right here. So you don't want them to lean back because they'll swallow the blood. You hold pressure and you have them lean forward for at least 5 minutes, no peeking. That's what I always recommend to my patients. And that, if it is a front part of the nose nosebleed, then that should stop the bleeding relatively quickly. If you're concerned about these really long nosebleeds that your kids are having, they probably need some blood work done to see if they're anemic or to be referred to see a hematologist to see if they have a bleeding disorder, sometimes von Willebrand's. There's different types of von Willebrand's that could be due to not having enough clotting factors, like a factor 8 clotting deficiency. So that is a more extreme end, but we see everything under the blue moon. So you just have to rule out any other bad things that could happen. And again, when you do see an ENT provider, we will likely recommend conservative measures before jumping to do a nasal cautery, and also to look with a nasal endoscopy to rule out any sort of tumor or like a little ball of blood vessels that could be in the nasal cavity. So just keep that in mind and make sure to ask lots of questions. And if you have any questions, please feel free to drop them below and I could try to answer them for you. So that's all for today on Nosebleeds. Tune in next Friday. I'm going to be discussing the complicated topic of dizziness. I hope everybody has a great weekend. Take care.